Hey everyone, welcome back to the channel. I'm your family doctor, the one who sits across from you in the exam room, looks at your lab results, asks about your sleep, and genuinely wants to know how you're doing, not just your numbers, but you. And today we need to have a real conversation, a conversation that might just change the way you think about your body and maybe even save your life. Here's the question I want you to really sit with. Where does your body actually warn you before your heart gets into serious life-altering trouble? If I ask that in my clinic, 9 out of 10 patients point straight to their chest pain, tightness, pressure, a heavy feeling, and you know what? They're not wrong. That is a classic warning sign. We all know that, but today I'm going to tell you about a place that almost nobody ever thinks about, a place you use every single day. From the moment you step out of bed in the morning to the moment you collapse on the couch at night, a place you walk on, stand on, run errands on, shove into sneakers and dress shoes, and almost never ever look at your feet. Yes, your feet, the very foundation of you, and they might be quietly, persistently, patiently sending you signals that your heart and blood vessels are already in a pretty dangerous zone long before you ever feel a single twinge in your chest or any classic symptom. Now, I want to be really clear right up front. This isn't some weird internet theory. This isn't a fad diet or a wellness trend. This isn't something I read on social media. In fact, traditional medical systems have described this connection for thousands of years, and modern medicine, with all our technology and imaging and blood tests, is catching up to it more and more every day. The problem is, most of us were never taught how to read these signs. We never learned the language. So today, we're going to slow down, walk through it step by step, and decode exactly what your feet are trying to tell you. Think of this as your crash course in foot-to-heart communication. But before we dive into the details, let me set the stage properly. There isn't just one change to look for. There are actually 4 key changes, 4 red flag patterns that I want every single one of you to memorize. If you notice one of these, consider it a yellow light. Slow down, pay attention, and start a conversation with your doctor. If you notice 2 or more, that's a red light. That's when I'd say in my practice, let's not wait, let's get this checked out thoroughly, because when your body is sending multiple signals, it's not being subtle anymore. So what are those for? Well, get there, I promise. But first, we need to understand the why behind it all, because once you understand the underlying logic, the signs will make so much more sense and you'll be able to spot them much more easily. Here's how I want you to think about it. In traditional medicine, and honestly, this is backed by basic physiology and anatomy too, the heart is never looked at in isolation. It's not just a muscle sitting there like a mechanical pump. It's called the ruler of all your blood vessels. Think of it as the commander-in-chief of your entire circulatory system. Every single drop of blood in your body, from the top of your head to the tips of your toes, relies on your heart to push it where it needs to go. Your heart contracts, blood flows, and that blood carries life-giving oxygen and essential nutrients to every organ, every muscle, every tiny little cell in your body. So when your heart starts to struggle, even just a little bit, even in ways you can't feel yet, it doesn't just affect one spot. It affects your entire system, and that's the first big idea I want you to hold on to. Heart trouble is never just local, it's whole body. It's systemic. It's like the engine of your car starting to sputter. You might not hear the noise yet, but the whole car is going to feel it eventually. Now, here's the next logical question. If it affects the whole body, why would the feet be the first place to show warning signs? Why not your hands? Why not your ears? Why not somewhere else? That comes down to a very simple principle: distance and gravity. Your feet are the farthest point from your heart, the longest distance for blood to travel, and they're also the lowest point where gravity pulls everything down in any system. Whether it's a garden hose, a heating system in your house, or your own circulatory network, the farthest, lowest point is always the first place where you see problems when pressure drops or flow slows down. Your body is incredibly smart, and it's also incredibly protective when blood flow becomes limited for any reason. Your body prioritizes. It makes a split-second decision and says, I need to protect the brain, I need to protect the heart, the lungs, the kidneys. Those are non-negotiable, so it diverts blood away from the ends, your hands and your feet, to keep your core organs alive. That means your feet are literally the first to lose supply. They're the early warning system. They're like the canary in the coal mine. Also, think about gravity throughout your day. You're upright most of the time. You're standing, walking, sitting with your feet down. Blood naturally wants to pool in your lower body. So if your heart isn't pumping efficiently, Fluid and blood start to collect at the lowest point, your ankles and feet. That's why your feet are such sensitive, reliable indicators of what's happening inside. And here's another layer that I find fascinating. In traditional medicine, there's a very important concept called the connection between the upper and lower body. The dynamic interplay between your chest and your lower abdomen. The heart is in your chest, upper body. The kidneys are lower down, near your lower back, and there's a constant dynamic balance between them. The heart's energy needs to go down to warm and support the lower body, and the lower body's energy needs to go up to support and nourish the heart. It's a two-way street. When that balance tips, when either side gets weak, problems start to show up, and because the feet are where that lower energy originates and flows from, they're often the very first place to reflect that imbalance. It's like watching the needle on a gauge. The feet are your dashboard, so with all that in mind, distance, gravity, and that upper-lower balance, let's get into the first of the 4 changes. Change number 1, skin color and temperature changes on your feet. Let me ask you something honest. When was the last time you actually took off your socks, sat down, put your feet up, and really looked at the bottom of your feet? Like actually examine them with intention. Most of us never do. We put on socks in the morning while we're half asleep. We pull on our shoes, we run around all day, and we don't think about them again until we take a shower at night. They're completely out of sight, out of mind. But if you have a minute right now or later tonight when you're winding down, I want you to take a good long look. You might be genuinely surprised by what you see. A healthy foot in a person with good circulation should have a nice light pinkish tone, not too red, not too pale, not blotchy, just a consistent healthy pink. The skin should feel elastic and supple, and when you touch it with your hand, it should feel warm, roughly the same temperature as the rest of your body. Not hot. Not sweaty, but definitely not cold. It should feel alive, but here's what I want you to watch out for. If you notice that your feet are looking bluish, purplish, or even mottled with patches of darker color, especially between your toes, around your toenail beds, or on the soles, that is a serious warning sign in plain English. That color change means blood isn't flowing properly. Your blood is carrying oxygen, and when blood flow slows down and stagnates, the oxygen level in that tissue drops, and your skin turns that dusky blue-purple color. We call that poor perfusion or cyanosis in medical terms. If that purple or blue color is showing up on your toe tips, the very ends of your toes, that's even more concerning. Those are the absolute farthest points from your heart. If blood can't even get there, it tells me your heart may not be generating enough pressure to push blood all the way through your circulatory system. It's like a garden hose with low water pressure. The spray barely dribbles out at the end. You might still get water, but it's not enough to do the job. Now let's talk about temperature. Do your feet feel ice cold, not just a little cool on a winter day when you've been outside? I'm talking bone chilling, deep cold. The kind of cold where you put on 2 pairs of wool socks, you use a heating pad, you rub them vigorously, and they still feel like blocks of ice. And here's the key, if that coldness doesn't go away in summer, if it's there year-round inside your heated home in July. That is not normal. Many of my patients say to me, "Oh, doctor, I've always had cold feet. That's just how I am. My mother had cold feet. It runs in the family." And I gently, respectfully tell them it might be how you are and it might run in your family, but that doesn't mean it's healthy or normal. That means your family might share a circulatory pattern that deserves attention, persistent. Severe coldness in your feet is often a sign that the warmth, the energy, the blood flow simply isn't reaching your extremities, and that comes right back to your heart not pumping with enough strength to send that warmth all the way down against gravity. Then there's the skin texture. What if your feet are not just cold, but also dry, extremely uncomfortably dry? The kind of dryness where the skin starts to crack, deep, painful fissures, especially around your heels. Some people get cracks so deep they bleed, and a lot of folks say, "Oh, I just need better lotion. I need to moisturize more. I should try that expensive foot cream from the drugstore." And I'm not saying moisturizing is bad, of course. Take care of your skin, keep it hydrated, use good products. But if you're using heavy creams every single night, you're exfoliating, you're doing everything right, and your heels are still cracked, still peeling, still flaking, that is not a skincare problem. That is a blood nourishment problem. Your skin needs moisture, yes, but more than that, it needs nutrients and oxygen from your blood. Your blood is what feeds your skin cells, repairs them, regenerates them, keeps them supple and elastic and healthy. If your heart isn't sending enough good quality blood to your feet, your skin becomes starved, it dries out. It thickens, it loses its flexibility, and it cracks. So when I see a patient in my clinic with chronic treatment-resistant cracked heels, I don't just think about foot cream, I think about circulation. I think about the heart. So to recap this first category, bluish purple color changes, persistent coldness that won't warm up no matter what you do, and severe dryness or cracking that doesn't improve with regular moisturizing. These are all signs that your blood isn't reaching your feet the way it should, and when blood doesn't reach your feet adequately, the root cause more often than not is your heart not pumping efficiently enough to get it there. Change number 2, swelling in your feet and ankles. This one is incredibly common. I see it almost every single day in my practice across all ages, and almost nobody connects it to their heart until I sit down and explain it. Then the light bulb goes on. Let me ask you, have you ever noticed that your ankles or the tops of your feet look puffier in the late afternoon or evening than they did in the morning when you woke up? You get up, you put on your shoes, and they fit fine. You go through your day working, standing, walking around the grocery store, sitting at your desk, chasing kids, running errands. And by the time dinner comes around, your shoes feel tighter, your socks leave deep, noticeable indentations around your ankles, and then if you press your finger into that swollen area right over the bone of your ankle or on the top of your foot, you see a little dent that stays there for a few seconds before slowly filling back in. That's called pitting edema in medical terms. It's basically fluid that has leaked out of your blood vessels and settled into the surrounding tissue because your circulation isn't moving it along efficiently. Now, I want to be fair here. Sometimes if you've been on your feet all day, especially in hot summer weather, or after a long flight across the country, or if you've been eating a lot of salty food, a little bit of swelling that goes away overnight after you put your feet up is usually not a big deal. That's mostly gravity and temporary fluid shifts, but here's where it gets concerning and crosses into red flag territory. If you wake up in the morning and that swelling is still there, it hasn't gone down at all overnight, or if it's getting progressively worse day by day, week by week, or if it's happening in both ankles at the same time, symmetrically, not just one side from an injury, those are huge red flags. And there's an even more serious combination that I want you to remember. If that swelling comes with shortness of breath, like you get winded walking from your car into Walmart, or you feel like you can't take a deep breath when you're just sitting on the couch, that is a medical warning sign. If you lie down flat in bed at night and feel like you're suffocating, or you have to prop yourself up with 2 or 3 pillows just to breathe comfortably, that's not normal. That's a sign that fluid is backing up into your lungs because your heart can't keep up. Here's the physiology. When your heart doesn't pump strongly enough, blood starts to back up in your veins. It's like a traffic jam on the highway. Blood coming back to the heart from your lower body can't get through efficiently, so the pressure builds up and fluid seeps out of your veins and into the surrounding tissue. Because gravity pulls everything downward, that fluid collects in your lowest point, your ankles and feet. As your heart function declines further, that swelling can creep upward to your calves, your knees, your thighs, and eventually even into your abdomen. That's what we call cardiac edema in Western medicine. It's a classic sign of heart failure, but note that doesn't mean your heart has stopped. It means your heart is struggling and needs support. In traditional terms, this is described as the heart's pumping power weakening, and the body's ability to move and metabolize fluids breaking down. The fluid just sits there stagnant and heavy. So if you have swelling, that doesn't go away after a good night's rest, especially if it's getting worse over time, and especially if it's paired with any breathing difficulties. Please do not ignore it. Don't tell yourself it's just from standing too long. Don't blame it on your new shoes. This isn't just getting older. This is a sign that your heart needs medical attention, and the sooner we catch it, the more we can do to help you. Change number 3, changes in your toenails. I know. Toenails of all the things to talk about. Most people don't give them a second thought. They clip them, they ignore them. They paint them maybe, and that's it. But as a doctor who's spent years looking at thousands of patients' feet, I can tell you with complete confidence, your nails are like little billboards for your overall health. They reflect what's happening inside your body. Let's start with what healthy nails should look like. A healthy toenail should be smooth, not too thick, not too thin. It should have a nice gentle shine, not dull, not chalky. And the color should be a uniform, consistent pinkish tone. When you press on it, it should be firm but have a little bit of flexibility. That's a well-nourished nail that's getting a steady supply of good blood flow. Now, here are the specific changes I want you to watch for. First, thickening and brittleness. If your toenails are getting thicker and thicker over time, like they're growing into little shields and they break easily, they crack. They split, they chip when you try to trim them. That's often a sign that they're not getting enough nutrients. Yes, fungal infections can cause thickening too, and that's very common, but if you've tried over-the-counter antifungal treatments or you've seen a podiatrist and it's still happening, Or if it's happening on multiple toes without any obvious signs of fungus, think about your circulation. When blood flow is poor, your nail growth slows down and the quality of the nail itself suffers. It becomes brittle, dull, thick, and prone to breaking. Second, vertical ridges. Look at your nails from the side. Do you see deep lines running from the cuticle all the way to the tip? And when you run your finger over them, can you actually feel the grooves like little valleys? Some very mild ridging can be a normal part of aging. I'll grant you that, but deep, prominent, multiple ridges, especially if they're getting more pronounced over time, are often a sign of significant blood deficiency. The nail bed isn't getting the steady, rich supply of oxygen and nutrients it needs, so the growth becomes uneven and ridged. Many of my patients in their 50s and 60s say, "Oh, it's just aging. Everyone in my bridge club has ridges." And I tell them aging doesn't have to mean deep ridges and brittle nails. Let's check your circulation and your nutritional status. There may be things we can improve. Third, and this is the most serious one, color changes to dark purple, almost black. If your toenails start turning a dark, dusky purple or even a blackish color, that's a very serious sign. That means blood is pooling and stagnating in the tiny, delicate vessels under your nail bed. The blood isn't moving, it's sitting there, backing up in medical terms. That's venous stasis or poor peripheral circulation in traditional terms. It's described as blood stasis blocking the vessels, and it's considered a crisis signal, a sign that your circulatory system is in real significant trouble. Here's a simple practical test you can do at home in about 10 seconds. Take your thumb or your index finger, press down firmly on your toenail until it turns white. That's you pushing the blood out of the tiny capillaries. Then let go. In a healthy person with good circulation, the pink color should return in about 2 seconds, 1/1000 to 1000. That means blood is flowing back in quickly and strongly. If it takes 3 seconds, 4 seconds, even 5 seconds for the color to come back, or if it comes back slowly and patchily, that means your peripheral circulation is sluggish, and when your peripheral circulation is sluggish, the root cause is often your heart not pumping with enough force to push blood all the way out there. So yes, look at your toenails. They're not just cosmetic. They're not just for pedicures. They're a window into your cardiovascular health, and they're speaking to you every single day. Change number 4, pain and numbness in specific areas of your feet. This is the most subtle one and the most easily dismissed. So I want you to pay extra close attention here. Have you ever had a strange, vague, hard to describe ache in the very center of your foot, right in the arch, that hollow spot? Or maybe your toes feel tingly, like they're half asleep, like they've fallen asleep on you, or you get a weird pins and needles sensation, like tiny ants crawling on your skin. And sometimes your foot feels like you're walking on a thick layer of cotton or foam. You can't really feel the ground beneath you. The sensation is just dull and muffled. Most people brush this off immediately. "Oh, I walked too much today. My shoes are too tight. I should have worn my sneakers. I just need to rest and elevate them." And sometimes, yes, those things are true. But if these sensations keep happening, if they come and go without a clear trigger, if they're getting more frequent, or if they're happening at rest, not just after activity, they deserve a much closer look. Let's start with that ache in the center of the arch, the hollow of your foot, right in the middle. That specific spot is considered a very important point in traditional medicine. It's described as the source of your body's foundational energy, the place where energy wells up from below like a spring. When that area is painful, especially when you press on it with your thumb, or if it's overly sensitive to light touch for no obvious reason. It can be a sign that your foundational energy is running low. Think of it as your body's battery starting to drain. And when that foundation weakens, your heart loses its support from below. The upper body and lower body are supposed to work together in harmony. And if the lower part is failing, if your foundation is shaky, the upper part, your heart, has to work much harder and becomes more vulnerable. Now let's talk about numbness. Numbness in your toes, or that tingling, crawling sensation. That's often a sign that your nerves aren't getting enough blood flow. Nerves are incredibly sensitive to oxygen and glucose. They need a constant, rich supply to fire properly and send signals. When circulation slows down, nerves are among the first to complain. They send you these weird signals, tingling, numbness, a feeling of heaviness or detachment from the ground. In medical terms, that's called peripheral neuropathy, and while it has many causes, diabetes is a big one. For example, poor circulation is one of the most common and most overlooked. And then there's a specific pain pattern that I hear about a lot, a burning sensation or a sharp stinging ache in the front part of your foot, right behind your toes, the ball of your foot. The metatarsal area, some people notice this when they've been walking for a while, 10 minutes, 20 minutes, half an hour. They feel a burning or stinging pain. They stop and rest and it goes away. Then they start walking again and it comes back. This repetitive, predictable pattern, pain with activity, relief with rest, can be a sign that your muscles and tissues in that area aren't getting enough blood supply exactly when they need it most during exertion. It's like your foot is saying, I need more oxygen right now because I'm working and I'm not getting it. So if you have any combination of these arch pain that's sensitive to touch, toe numbness or tingling, that cotton wool feeling or burning in the ball of your foot that comes and goes with walking, don't just assume it's your shoes. Don't assume it's just fatigue. It could be your circulation, and that circles right back to your heart. Now, I want to be absolutely crystal clear. Your feet aren't the only place where your heart sends warning signals. They're the most overlooked, so I spent extra time on them. But there are other whole body signs that I also want you to know, and I'm going to run through them quickly because they're just as important. First, chest tightness, shortness of breath, palpitations, and that feeling of dread. I know most people know about chest pain, but let me be more specific because the details matter. Chest tightness can feel like a heavy weight sitting on your sternum or like a tight band that's squeezing your rib cage. Shortness of breath means you're getting winded doing things you used to do easily. Climbing a flight of stairs, carrying groceries from the car, walking across a parking lot. Palpitations can feel like your heart is racing for no reason, or skipping beats, or suddenly pounding hard and fast against your chest wall. And there's something called a sense of impending doom, a vague, anxious, gnawing feeling that something is terribly wrong, even if you can't put your finger on it, even if you have no reason to be anxious. If you experience these symptoms repeatedly, especially together, please see your doctor. Don't wait. Don't tell yourself it's just stress. Second, pain in the back, specifically between your shoulder blades. I see this all the time. Patients come into my office with a dull, nagging, deep ache right between their shoulder blades, and they think it's muscle tension from sitting at a desk or hunching over their phone. They get massages, they use heating pads, they stretch, they try over-the-counter pain relievers, and it doesn't go away. That area is anatomically close to where your heart's nerve pathways run. A deep, persistent ache there, especially if it's not related to any injury or obvious muscle strain, should be evaluated. Third, pain radiating down your left shoulder and arm. This is a classic sign of a heart event. The pain can start in your chest and travel down your left arm into your forearm, even all the way down to your pinky finger. It might feel like aching, burning, heaviness, or even tingling. If you have unexplained left arm pain that doesn't come from lifting something heavy or sleeping in a weird position, and it's accompanied by any chest discomfort or shortness of breath, do not ignore it. Call 911 or go to the emergency room. Fourth, waking up at night, having nightmares, and feeling restless. Your heart also affects your nervous system and your sleep quality. If you find yourself waking up frequently at night, especially with a start, gasping for air, or after having vivid, frightening dreams that leave you shaken, and you feel anxious, restless, or unsettled during the day for no clear reason, that can be connected to your cardiovascular health. Your heart and your mind are deeply biochemically linked, so don't dismiss sleep issues as just bad dreams. So here's the takeaway, and I want you to really hear this deeply. Every single change in your body, every color change, every swelling, every ache, every nail ridge, every tingle, it's not random. It's not meaningless. Your body is not a chaotic, unpredictable machine. It's constantly communicating with you, constantly sending you data, constantly giving you feedback on how you're doing. The question is whether we're paying attention enough to read it. You don't need to be a doctor to notice these signs. You just need to be intentional. Take 5 minutes tonight, just 5 minutes. Take off your socks, put your feet up, look at them really look, press your ankles, check your nails. Feel the temperature with your hands. Ask yourself, does anything look different? Does anything feel different? Is anything new? Is anything getting worse? If you notice one of these signs, don't panic. Panic doesn't help anyone, but do make an appointment with your primary care doctor. Bring it up at your next visit. Say, hey, I notice my feet are cold all the time, or I have swelling in my ankles that won't go away, or my toenails have changed and I'm worried. A good doctor will listen to you, take you seriously, and help you figure out whether it's your heart, your circulation, or something else entirely. And if you notice 2 or more of these signs, that's when I'd say in my practice, Let's not wait for your annual physical. Let's get some tests done, blood work, an EKG, maybe an echocardiogram, because this could be your heart telling us something important. I also want to say this, and I mean it from the bottom of my heart, you have more power over your heart health than you think. You are not a victim of your genetics. Small, consistent changes like walking 30 minutes a day, eating more whole foods, cutting back on processed salt and sugar, managing your stress, getting 7 to 8 hours of sleep, they add up over time. You don't have to be perfect. You don't have to overhaul your entire life in one day. You just have to start with one small thing this week, and your body will reward you. It will start to feel warmer, more energetic, more alive. I've seen it happen with thousands of my patients. If this video helped you, or if you've noticed any of these signs yourself, please drop a comment below. I'd love to hear from you. Share this with someone you love, your spouse, your parent, your adult child, a friend, because sometimes the person who needs to hear this message won't hear it from a doctor. They'll hear it from you. And that might be the nudge they need. And as always, I want to remind you, because I take this very seriously, this video is for educational purposes only. It's not a substitute for professional medical advice, diagnosis, or treatment. I'm here to help you understand the science, the warnings, the patterns, but I am not your personal doctor. If you're dealing with any health concerns, especially heart-related ones, please schedule a visit with your primary care provider. Get checked, get peace of mind. That's what I want for you. Take care of your feet, take care of your heart, and take care of yourself, because you're worth it. I'll see you in the next one. Disclaimer. This content is for informational and educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.